3. Okay? 1.
No!
What's going on, YouTube? Thanks for coming back and checking out another episode of The Pit with us tonight, 10 a.m., episode 4. I'm Dr. Todd, by the way.
I'm Allycia. I was just a little thrown off by how fast you said that.
This is why you don't drink coffee at night. I'm just kidding. I'm just pumped up for another episode of The Pit.
Okay.
Don't want to waste too much time. I want to jump into this, but like a really, really quick thing. We did film an episode of our in-depth Pit called The Pit Stop show, where we're going to break down some of the more in-depth themes and topics from the Pit.
First topic is
substance abuse in the way that the show has portrayed substance abuse and addiction. We wanted to talk about like 3 topics, but that conversation went like an hour and a half. So we're just going to do one tonight, and then we're going to break it up so that we don't expect anybody to watch an hour and a half. But anyway, wanted to get that out there, let you guys know that that's coming before we jump into episode 4. Anything to add?
No, nothing to add. Nothing per brain.
Really? That made me think of the Bee Gees, the Saturday Night Live skit with Jimmy Fallon, where he's like, "Do you have anything to add?" You remember with Justin Timberlake playing Robin? He's like, "No,
No, I don't.
no, I don't."
Yeah, I remember that.
All right. Anyway, that's enough of that.
Mm-hmm. This isn't Scrubs. This is The Pit. We have to be more serious.
It's not going to happen.
It's gonna happen. We have no sadness today. Some brief nudity, maybe. That's what it says.
I'm game.
Oh my God, no.
The man is in his element.
What's he doing?
Age-old ritual. Meant to
Why are you laughing? Oh, it's the wager.
Whoever guesses the reason they went code black wins a pot.
Interesting. We didn't do this at the VA.
I'm sure you didn't.
Game?
Of course.
Okay.
Oh,
yeah,
okay. She's
I like
gonna
it.
play.
Gonna have a little fun.
You want to bring Langdon back from triage for the extra hands?
No, I do not. I don't think that's necessary. We're doing just fine without him.
It's gonna take him a while to get over that.
Know. Oh, so the air's out? Did I miss that?
I just think it's the 4th of July.
Oh,
man.
okay.
It's hot as heck.
That was 2 hours ago.
We're really busy, but we'll get to you.
Okay, when?
I will check.
I heard that was Langdon's girlfriend, right? Is that what someone said in the comments? That was the eye?
Like in real life?
Yeah.
Oh, that's cool.
But my head still hurts. And now my stomach does too.
What did she eat before she took her ibuprofen?
Always wanted to be able to do sign language.
It's okay to look at me.
Oh.
I don't bite.
I got that.
So this is really hard when you have an interpreter. You should maintain eye contact with the patient, but it is hard sometimes when
Yeah.
you're. So I like that they displayed that.
Lucky me.
You can take off your mask. Pulse ox, is that 91?
Pneumonia?
Could be.
That makes you a Cancer, right?
I didn't peg you for an astrology girly. Girl.
Been spending too much time around Santos.
Oh.
I don't know how you guys do it. Live together and work together?
So everybody knows.
Yeah.
I can tell you've been spending a lot of time on that farm.
Farm?
Remember the burned farmer who came in last year? Propane tank exploded. He died in the ICU.
Oh.
He has been playing house with his widow and their baby.
Interesting.
I've been helping Amy out on the farm after her husband died, and she's a friend. She's just a friend.
Sure, just a friend with farm benefits. Oh, use your imagination. You ever see a milking machine?
Can we not talk about this, please?
I think.
Santos brings the fun.
Well, I think Santos has been like the MVP this season.
I know.
Deficient charts leave a gap for the providers who give continuity of care. It delays hospital billing.
She kind of annoys me.
Yeah, quite a bit.
Timely documentation is essential. You wouldn't want to repeat your R2 year again because of this.
Oh, you got to be kidding
Oh,
me.
she's threatening her now.
You got to be kidding. I once had a mentor that said, "Don't ever let patient care get in the way of a good meeting." He was being sarcastic,
Yeah, obviously.
but he would have had a lot of fun with this.
So, Dr. Al-Hashimi,
Yes.
do we like her? Kind of gossip about an attending with an attending? Dr. Robbie doesn't mind, do ya?
Lip sealed.
Yeah, the silence says it all.
Yes.
Let's see how she feels with some Zofran and a liter wide open.
A liter wide open.
So wide open just means, yeah, that there's no, like, you're not slowing the drip down.
Okay.
Blam.
Repeat 12 lead, check a troponin, admit for new onset angina.
Evaluate for P, aortic dissection.
Someone suggested we turn on subtitles. I should have listened. I really my hearing sucks.
Maybe next episode.
Sats 99 on 5 liters. No meds, no allergies.
Hey, Vince, how'd you fall through a skylight?
Oh, you fell through a skylight?
We were parkouring and he overshot.
Hardcore.
People still do that?
It's almost an Olympic sport.
Now we know why it is.
Almost an Olympic sport.
10 feet, 10% mortality.
0%. Anything over 0% is a concern.
Somebody's annoying and it's not me.
10 feet. That's pretty far fall.
Yeah.
Squeeze my hand.
Checking. Oh,
So they're calculating the Glasgow Coma Scale.
Whoa, whoa, whoa. You can't film in here. We've got patient privacy laws. Can somebody show Spielberg here?
Put the camera down.
We have to drop this video for the 4th tonight.
That literally means nothing to me.
Seriously.
Absent gag. We need to intubate before CT.
oh,
It sucks. End tidal CO2.
It reminds me of someone I know very well.
Santos.
T waves are kind of high with ST depression anterior. We see ST depression all the time. Could be a posterior MI.
am I?
Myocardial infarction. Heart attack.
Oh, okay.
Victoria, if his CT's normal, he'll need an LP.
Stop using all the initials.
Lumbar puncture.
Okay.
Just did my first ER intubation.
That's great, man.
Such a prick.
Such a prick.
Might be suspicious for a posterior MI.
Agreed.
Look at him.
Good catch.
I know.
DKA? It's a serious complication of your husband's diabetes.
How serious? Can he go home?
Oh, he was a DKA
Yep.
patient.
It's okay, Mom. Things are headed in the right direction, Mrs. Diaz. He's going to be better.
There's something more to this.
I know. He's going to be better. I didn't like that she said that.
Thing is, we don't have health insurance. So I don't think that we can afford this.
Yeah, I mean, this is a huge topic
Yeah.
that we can talk about. How incredibly broken healthcare is.
You're not jaded from it.
Try this.
Yeah, that makes sense. You think you could...
He's not used to doing the EKG. EKG?
KG.
I'm hosting a 4th of July party tonight. You want me to show up like this?
Kind of look like Picasso.
Just wear a patch.
Like a Picasso painting,
I
right?
trim
Like,
your eyelashes halfway down. That'll lower the strength of the glue
Yeah, but
holding them together.
do you remember what happened? So our daughter, she cut her eyelashes off.
oh, yeah.
She was like, it'll grow back. I was like, not like you think. No, it won't. They just now got back. It was months ago.
Yeah.
Okay, here we go.
Perfect, Mr.
Okay,
Samba.
perfect. So-
All good here.
The heart has two like main blood flow distributions: the front of the heart, the anterior, and then the posterior portion of the heart. So behind the heart, what he's picked up here is that there was a subtle change that prompted him to say this could be a posterior MI. And so by changing the leads around, he was able to get like a better waveform.
Okay.
So we don't do that very often.
B9, it's a posterior STEMI.
Yeah. And blood pressure
The
is
worst kind of heart attack.
The worst kind of heart attack. Oh, God.
Mr.
The
Samba,
crash team, right?
Hey, I could use a second set of hands. Hold Sliss VTAC. Start compressions.
Yep. And then charge it up.
So he's running the code then.
Yeah, good call.
You put the defib pads on? Yeah, just in case.
Oh, that was smart. They hear he had the pads on him.
Got a strong pulse, check a BP?
All right, we'll prep him for cath lab.
He looked shocked. Whitaker.
You're going to be okay.
Well, that was
No
quick.
pearly
Yeah.
gates today.
Really good pickup, Whitaker.
Don't leave me hanging.
Oh, is he saying, hey, you like me now?
Sure.
Really.
Well, there's this guy this morning. He turned out to be a criminal. What? Do you have any questions to ask our patient?
No, I'm good.
Is he a little distracted?
Yeah.
We're gonna need a chest X-ray to check your lungs. You can go put the orders in.
Okay. That's like interesting. Santos.
How are we doing in here?
Oh, this is thrilling. Definitely worth $200,000 worth of student debt.
I don't think I would have ever though been like that confident to joke with my attending.
Yeah, like that.
I didn't realize your name was Joy. I'm gonna have to tell my parents how trendy they were. Need an epi if that doesn't work?
Are the admin orders in for surgical ICU?
She freaked herself.
Oh.
Irrigation?
Oh, he's happy about it.
Oh, what a jerk.
Is a work-related blood exposure, which means you're a patient.
Yeah.
Give yourself a dose of PEP if you want while you're waiting for results.
Of PEP?
Post-exposure prophylaxis. So medicine just in case you're exposed to a transmissible disease.
Thinking about changing your vet?
I am just weighing my odds.
Don't worry. I'll buy you a drink with my winnings.
Oh, she's hitting on him now.
He's confused by her.
I know.
I mean, he's the friendliest guy I know. He never even gets angry, he barely yells.
You think this was a case of racial profiling?
Well, it seems like he was definitely targeted, but I really don't know what would have prompted the interaction.
Yeah.
The new radiologist is a hottie.
We're not sure yet. There is another test,
LP.
viral encephalitis, that can also cause altered mental status and confusion.
Oh, okay. It's interesting.
Just what we thought. It's a fracture of your coccyx. It's your tailbone.
Your butt bone.
Do I need surgery?
No. These heal pretty well.
Just need a donut, right? That was the theme last week.
Oh, yeah.
Donuts to sit on,
Yeah. I thought you were referencing the donut of truth.
No, there's lots of donuts.
Yeah.
A nightcap at my place usually follows, and then breakfast in bed.
Oh, wow. He's really hitting on her.
Well, in that case, you might need to take a little break.
My greatest joy in life is my social calendar.
Was he hitting on her or just saying that's what he normally does?
I think he's just highlighting that he's a playa.
Okay.
Push the fragments back in place, but it'll hurt pretty bad.
I can take it.
Oh, here's the other guy.
How's it going over here?
Better now. So I won't be seeing you again.
As a patient, no, but it was nice meeting you, Brian.
Oh, no, she's going to go back. Oh.
Have you been to that one on 40th and Butler?
No, I was gonna go by maybe around 9.
Okay.
So this
It's crossing some lines.
ethical dilemma here.
I mean, he was barely a patient. Barely.
Yeah, I don't know.
Had a little foot pain.
Okay.
Oh, I want to see what's going on with Louis. I want to make sure this is just his mouth.
Tooth number 23, lateral incisor.
I think someone in the comments said that they've had an abscess tooth before and it was extremely painful.
Yeah, it is. Dental pain is amongst the most severe pain one can experience.
Dr. Collins around. My sister always helps me out.
Oh.
Took up a job in Portland as an attending physician.
Portland?
Yeah, I think that's where she's from. She's adopting a baby.
They're bringing up Collins. Then.
Yeah.
Oh, at least I closed that story.
Yeah.
CC syringe.
I can't do teeth stuff. I can't.
Entering at
No.
the
Is it done?
part.
Nope.
No, I can't. I really can't do this. Nope. I can't even listen to teeth being brushed, let
So
alone
not for
needles.
culture?
Is it done?
Pen
No.
paper,
God.
Bugs in the mouth are old school.
No. Okay, that's not the best.
I wonder how they did that.
I don't know. I didn't see it. I don't want to see it. I've got a fear of the dentist. I was tortured a lot as a kid. That doctor drilled on me when I was not numb.
Oh,
And I was screaming.
I had a similar experience.
Same doctor too, wasn't it? Same dentist.
Yeah.
Yeah.
How much will it cost to keep my dad in the hospital?
I don't know, but the ER visit alone will likely be in the thousands.
I mean, I don't know if you're talking about this later. There are some options for people, right, that can't afford the visit.
Yeah. No, there's some financial assistance things.
3.
Good blabber time.
Thank God.
Pop one on.
She said, oh, thank God.
Oh. No.
Shit. Is there brain damage? The head CT showed no bleeding or skull fracture. It's most likely a bad concussion.
Well, that's good.
Yeah. All things considered.
Yeah.
Chest and abdomen CT scans also showed no major internal injuries.
What's that?
What the heck? Oh, he's bleeding.
We need
Why is he
respiratory therapy in
smiling?
here.
I just think he's extremely eager and
No, he's bleeding from the back. Gotta prune him. Just take a look.
Yeah, but
We'll talk about this. This is
he's like dehumanizing. them.
well, yes, that's exactly what he's doing.
Here, I'll pull it out.
No, don't.
It's bigger than I thought it.
That looks arterial. Can I get some 4x4s over here, please?
Please. I can push it back in.
No, you've done enough damage.
Or should I keep pulling it out then?
Absolutely not.
Just
Stop. Just stay there.
Yeah, just be still, man.
So it's probably a big piece that like got lodged. Oh, in there. Okay.
Yeah, so this young guy seems to be more like he's obviously a gunner, as we mentioned in earlier episodes. He's viewing patients like cases, like he's viewing them like they're a number, like they're an opportunity for him to showcase how good he is and how talented he is, which is great. Like we want doctors who are confident and passionate and eager to do things, but that element of dehumanization of, oh, this is good, I get to do something. Oh, this is good, I get to showcase how good I am. When the stakes are somebody's life.
Yeah.
So that is definitely not an attractive feature, not a good thing. So he's being humbled at the moment.
Yeah, and hopefully that helps him.
Hopefully this helps him, yes. But no, you don't view somebody's pain.
He clearly hasn't seen death a lot from it.
Maybe he has. I think it's just, I don't know again, like if what the issue is with him, but not a good look, I guess. Ultimately, what I'm trying to say.
Stringy right lower lobe.
Yeah, it looks like aspiration pneumonia.
Oh.
An eating disorder.
Think she's bulimic?
Oh.
Fixated on working out.
She said she lives at the
Got
gym.
the enamel behind her front incisors.
She's getting excited too.
You know that. Yeah, you know that.
I love Mel being Mel in this episode.
know.
Jackson, can you wake up? Jackson.
They said he's sedated.
It was an interesting interaction.
Maybe wait until the patient wakes up before calling me down. Psychiatrists do best when we can actually talk to our patients.
That's a little weird. Okay, he might be being humbled this time.
Who's the genius to pull that out?
I thought it was a loose fragment.
Next time, leave the decisions to the adults.
Okay, I am injecting the X-Stat.
What is that?
It's a
What's an
syringe
X-Stat?
full of tiny, rapid expanding hemostatic sponges.
Okay.
Yeah, I'm not sure. I've not seen that.
Not anymore.
Sounds like first week in July syndrome.
First week of July syndrome.
Hey, don't they say like to avoid hospitals?
Yeah,
the
July
first week of
1st.
July. And probably just unlocked a fear in a lot of people.
Well, I think we referenced this in season 1, but
Yeah.
that the reference there is that all the new residents or interns start July 1st.
Yeah.
Well, let's get you a ginger ale.
So we never ever remove a deep foreign body in the ER. We always leave that to surgery.
Yeah.
It won't happen again.
And he's right, it won't.
It won't.
Because you learn. This is how you learn.
Yeah.
One motorcycle crash is not going to scare me off my trip.
I didn't say it should.
I hope he died doing what he loved.
That's optimistic.
Glass half full kind of guy.
Oh, is he?
There's always Zoom therapy.
Motorcycle trip is Zoom therapy.
Yep.
I'll bet somebody set off fireworks in the shitter.
How dumb is that? You think people are smart?
Oh, that's their
That's
their guess.
That's his gamble.
You want to get on the books?
Yeah.
I only take real money. None of that IOU bullshit.
$40 for power outage. Nice.
We got a big ball on our hands.
He's like, I will not eat this week.
She's one of the best doctors in Pittsburgh.
Oh, Dr. J.
Oh my God.
That's hilarious.
Here we go. Try to relax.
No. I don't want to.
With your mouth open.
Not how I imagined our first intimate encounter.
Okay. Now on 3. Okay. 1.
No.
I know. Sorry, it keeps you from tensing up. Okay, I think that worked. How does it feel?
Can I sit up?
She has someone wiping her face. I thought they were just gonna like press on it. You ever done that procedure?
No, never seen that.
Oh, I can't breathe.
Can I give you a hug?
Maybe later. The enamel on the back of your teeth is worn away.
It can happen if someone makes themselves vomit repeatedly.
Can you just give me some medicine?
Yeah.
Dr. J, finally.
She's famous.
Nice to meet you, Dr. J.
Look at her face.
Watch all of your videos. The one about coping with difficult coworkers was super helpful.
I gotta watch that.
What a watch, though.
Yeah.
My eye, it's...
Oh, it's starting to look better.
Then I would suggest cutting the full lash down.
I concur, Dr. J.
As long as you're the one doing it.
Oh.
I'll get you to close both of your eyes and be as still as possible.
Oh, you, Doc?
Thank you, Dr. Langdon.
How many followers do you have, Dr. J?
More than you'd guess, Dr. Langdon.
Her legend grows.
I know. She's gonna post about it. Dr. J, fix me.
Oh my God. This looks terrible. I can still put a false lash on it, though.
Put some more super glue on your eye.
What you say here remains between us.
I'm taking a lower dose of insulin than I should be.
You can't afford it, probably.
I started a GoFundMe for Dad.
A what? No. Take it down. Now.
He's proud.
Yeah.
You heard me. Take it down.
Jesus, Orlando.
No necesito eso.
It's not necessary, is that what he said? No necesito. No.
Yeah, I don't know.
Looks like you're stuck with us for the next 3 hours. You need to monitor your blood pressure.
How about a drink while I wait?
Water or orange juice?
Never mind.
Come on, Louie.
I know.
With perennial ryegrass, and you want to lightly water it.
Color me impressed.
What can I say? I like grass.
I like grass too.
You are a pretty good mower.
Thank you.
And I just want to say, I think it's great that you're in the Physicians Health Program. I know it's a big commitment.
Physicians Health Program?
Hard at the beginning, but, you know, I'm almost done with year 1 now.
Yeah, I mean, I don't know if that's like a universal thing. I mean, I think most systems have a program for doctors who have addiction or...
Okay.
Maybe this is the universe's way of telling you it's time to clear the air.
Maybe it is. Maybe it isn't.
He just wants to go on a sabbatical and forget about it.
Run from it.
Yeah.
What if
She's like, wait, what's happening?
we eat when we're celebrating, we're mourning, we just eat. But then I got to college and it was all about how you looked.
That's a lot of pressure.
Do you think like Santos is pulling from something from her past?
I don't know. Maybe.
Do you have any preference for type of therapist, male, female?
If there's a black woman, I'd like...
For what it's worth, bulimia versus anorexia. Right, so anorexia, kind of the other disordered eating, basically the extreme avoidance of food, compared to bulimia, which is that most people I think are aware of that, but that eat, usually it's sort of a binge then purge, is the general pattern of it. But bulimia is a whole lot more responsive to therapy, and it's
interesting.
Yeah, so in terms of recovery from it,
Okay.
anorexia is significantly less responsive. The pathology or the psychology behind that is much more challenging. And most people probably know this, but like telling someone who's anorexic that they're too skinny, they need to eat, only actually provides like support or reaffirms what they're doing.
Because that's what they were trying to do, is to do it to get skinny. I will say,
Right. It's an issue of body image. It's a significant issue with body image. So that's a challenge.
Growing up, obviously, as a female, you struggle when you're younger with body image.
Yeah.
I'd say most girls do. I never had any issues with, obviously, anorexia or whatever, and I actually had an extremely poor diet growing up. I just had a high metabolism.
Yeah.
Till I hit my 20s and my thyroid failed, and you know that caught up with me. But I just talking about body image. Like I used to get told all the time, just you need to eat more. You just need to eat another burger. You need to put on a little bit of weight. I had, it was a resource officer at school that would check my tray at lunch to make sure I'd eat. Like I didn't get a lot of food at home.
Yeah.
I looked forward to that cheeseburger and waffle fries with cheese and a Pepsi at school every day.
Yeah.
And I would eat every single bit of it and he would check my tray.
Yeah.
And
So,
it's just like...
which is pretty like dehumanizing.
It is.
And demeaning. But I think though that highlights it highlights this interesting point that obviously body shaming of any variety is wrong. It's bad. We shouldn't happen. I think most people recognize that body shaming those who are overweight or obese is maybe more common, or maybe more recognized. But it can happen the other way around too. Yeah. You see body shaming and it's usually women, because for whatever reason, society has determined that they're entitled to talk about women's bodies. You don't tend to see it as much with men, and obviously not okay to talk about anybody's body. But yes, I think it's worth highlighting that it can happen sort of on the other end of the spectrum of weight, where women often are body shamed for being too thin.
Yeah.
So
yeah, write that down. I have a little bit more I want to talk about it with pregnancy.
Oh, okay.
Yeah.
So we could talk about that at the end.
Black women tend to go underdiagnosed when it comes to eating disorders.
Really?
Yeah, unfortunately.
Interesting.
My sister and I were really picky eaters.
Yeah, I can contend with that.
Color and texture, vegetables and fish. Oh, eggs. I like eggs. Some slimy okra, asparagus. Just, disgusting.
Agree.
I gotta catch up on my charting.
She's kind of cold.
Yeah. Just wait until you get into medical, surgical, and cardiac ICU. I stands for intense. Dictate. Helps you go faster.
Dictate. Like talk to it?
Yeah. Like
okay.
Use what's called the Dragon or AI.
Yeah.
Didn't show on the 12 lead?
No, usually it doesn't. I think most clinicians would have missed it.
But you didn't.
No.
It's because he's Whitaker the Wise.
He is Whitaker the Wise.
Whatever, Fullberry.
Oh.
Okay, I'm sorry. Did I do something to bother you?
Nope.
Oh, man. She's having a hard day.
It looks like the infection isn't responding to the pills I prescribed you.
Could be an MRSA infection.
Oh.
Is it bad?
Not if we can get a handle on it.
Worse?
Or maybe worse.
Maybe, but okay, interesting. So yeah, I'm gonna kind of make a guess that. Well, so before we kind of dive into some of the post video or post episode comments, he mentioned that she was on Keflex, which is a cephalosporin.
Cephalosporin, what's that?
So these are a class of antibiotics commonly used for general infections. They cover a lot. They are part of a bigger class of medicines called the beta-lactams, which include penicillins and cephalosporins. So if somebody's allergic to penicillin, there's about a 3% likelihood that they're allergic to cephalosporins because of that beta-lactam component. Now, this is getting into a little bit of the nitty-gritty of like the chemistry, but cephalosporins are really good medicines, but like the second generations, and what that means is like the generation is, I guess you could, for argument of sake, just say it's a new group of medicine. They do not cover MRSA. And so I don't personally like them for cellulitis treatment, because if you see cellulitis, you have to contend with the possibility that it is an MRSA infection. And the cephalosporins may cover some MSSA, so methicillin sensitive Staph aureus, but MRSA stands for methicillin resistant. And so I typically would have used like clindamycin or doxycycline or even Bactrim, because those are the ones that are going to cover MRSA. So my first thought would be that this could be an MRSA infection that the antibiotic that they chose was not going to be effective against. Langdon is thinking that it could be something worse, so I guess we'll see it based on the way that ended. It's suggesting maybe it is.
Yeah.
Because you can get other like gnarly, Pseudomonas infections and things like that. Although usually that's going to have a like green kind of discharge to it. But anyway, that's interesting. We'll see what happens with that.
Yeah.
That's kind of an interesting medicine thing that I like. But I don't get happy.
I know.
Not like, oh, yes, I get to treat.
Yeah.
The prevailing theme of this episode, to me, at least the takeaway, or at least what I really want to talk about, is the insurance issue.
Yeah.
And we've mentioned some of this on earlier episodes, so I don't think it's any surprise now. But unfortunately, it is a very real thing where patients will decide or have to decide between paying the rent or taking their medicine. And obviously, there's nothing more heartbreaking as a provider or helpless feeling, frankly, to have something that like there is treatment, like there is good, easy, and actually inexpensive treatment. But because of the way the system's set up and because of the way these companies are able to exploit, the cost goes up despite the medicine costing $3 to generate or whatever. And then people can't get it. And then they end up in the hospital with these bills that are exuberant. But the whole thing is kind of it's all smoke shows. Like if you don't have insurance and they don't bill it through insurance, then you're going to get a better price. But if they do bill it through insurance, well, then the insurance is going to get billed this amount. They're going to negotiate a different amount. And then they're going to pay whatever percentage. So this could be kind of funny, but when you think about what insurance is, well, just for argument's sake, the very first company that ever sold insurance, like when they came up with the idea, can you imagine like conversation between like two people and they're like, hey, I have a great idea. Let's form a company and let's offer health insurance. Let's cover folks' health expenses because those can be expensive, but we'll charge them a set price that they pay us for us to do that. And if the whole community does that, well, then we can get rich. We make all this money. We're going to take a monthly fee, call that a premium. So then we're going to charge them this set amount after the premium that they have to meet in a year. And we're going to call that a deductible. And we're going to set that at $5,000. But then you'll pay for my healthcare coverage? Yeah, well, no, not exactly. So then we're going to split it. And then I'll cover 80%, but then you'll still cover 20%. Okay, will you at least cover my medicines? Yes. Will you pay for tests if I need them done? Yes. It's like it's just such a joke. So I mean, I guess the point is it is so incredibly broken, and I have solutions. They just need to call me. We could fix it. So I guess that's what's frustrating because I do think.
But they put caps on how much insurance companies could profit. Sorry.
So this is called. This is called. Tell my family I love them. This is called medical loss ratio. So this is the percentage that insurance companies are allowed to basically profit. And it's usually capped somewhere around 15 to 20%. And so it turns out 80 to 85% of what they take in does have to go to spend for health related care. So believe it or not, they actually do have to spend some of that money on providing health care. So what's one way to increase profit? Well, it's to increase cost of care. And so if you scale your cost of care from say 10 billion to 15 billion, well now that 15 to 20% becomes a whole lot more money. Yeah. And so it's beneficial for them to increase cost of care for everybody in order to increase the profits that these insurance companies are making. So like I said, that is extremely broken. Like not a good idea in any way, shape, or form.
So would you say it behooves the insurance company to deny coverage of preventative care testing in order to increase likelihood of a loftier cost from a hospital visit in the future? Or no comment?
No.
You shook your head. Wait, no, I'm just kidding.
Yeah, absolutely. So that's one way where you might not invest in a cheap solution when you can, believe it or not, it's better for them for you to end up sick with a big bill in the hospital. Sounds crazy, but it's not. Yeah. So anyway, that's a whole. I mean, that's a
whole can of worms.
But I'm happy to try to help if they call. But I know I mentioned that I made the comment early in the episode. I think like Santos has been kind of the MVP of the season with her quick-witted humor. Obviously, she's very talented. She's sort of becoming kind of the Langdon-esque character from season 1. But then the back half of this episode was kind of interesting with her. I don't know if it was maybe lingering from what Dr. Al had said about repeating the year. Oh, that's worth talking about. So I know I made the joke, don't let patient care get in the way of a good meeting. This is one of the growing frustrations from both doctors and patients, frankly, is that doctors are spending too much time in rooms with their face in a computer and not talking to the patient. And so we want to try to fix that. But then you have your attending saying, well, make sure you're doing this. And I understand like what she's saying is accurate about medical documentation is important. It's extremely important. And she's right. Continuity of care, it matters because if like I've seen this where I've had a patient come see me in the office after going to the ER, maybe 2 days prior. And I'm like, well, hey, you know, what were you in the ER for? And depending on the patient, depending on the issue, they may have a hard time describing what happened. They may be like, I don't know, they ran some tests and what they told me everything looked whatever. And so then I go and I try to find the ER notes. And if they're not done because this has happened, I'm like, okay, well, I don't know what happened to you in the ER. They have not finished their notes. So I can look at the images, I can look at the blood tests, I can look at all those things and try to maybe deduce. So yeah, like there is for continuity of care purposes, it is important, but I don't think threatening a resident in that fashion is going to be very effective. No. But I do, again, though, like I do like that she's showing flashes of like camaraderie. You know, she wagered on the bet. Yeah. She's sort of maybe kind of flirting a little bit with Dr. Robbie. Mm-hmm. So she's coming around a little bit and then kind of throws that administrative element in there. I know. So anyway, we'll see. We didn't find out. I was thinking we'd find out what the code black was. We did not. No. They're going to keep us. I mean, I can't remember the name of the security guard, but give me $100 on a cyber attack. Put me in on that. Yeah. No one's guessing that.
I know it's because that's what it is, right?
No, I mean, we have no idea of knowing that. Yeah. We'll see. Maybe next episode. All right. Well, stay tuned for that, guys. Thanks again for coming around. I don't think we said it in the start of the episode, so please consider subscribing.
Like, comment.
Yeah, keep all the comments coming because they've been great.
We love reading them.
And yes. Until next time. Good night.
See ya.
I am Dr. Todd.